Hello. Right. A very good morning to all. We today start with a brief discussion on scrotal swellings and scrotal swellings in an MBBS examination and for an MCQ examination also constitutes one among the most important topics, particularly for a practical examination. And then the approach to a scrotal swelling is required for a theory examination sometimes. What is important is that the scrotal swellings includes a vast array of swellings starting from an hydrocele, starting to a testicular tumor, an epididymal cyst, not so common things in an examination perspective, a epididymoorchitis, but very common in an examination perspective is something called as a testicular torsion. Now, whenever you start with a discussion on a scrotal swellings, remember that scrotal swellings, when you start the discussion about, is everything to deal about what are the contents of the scrotum and what are the things that we know about in the scrotum with the contents. Now, whenever we start with the discussion on the scrotum, just a very few things in anatomy to know, because in the hydrocele class we'll be discussing them in details. The scrotum looks like a bag or a purse-like structure and essentially contains the outer layer of skin and immediately followed then by the next layer as a bunch of muscles which is called as the dartos. Just remember this one, cremaster is not the muscle down here. So the second muscle down here is technically called as the dartos. Now, what students make mistakes in an examination is that they say there is spermatic fascia. Not exactly. After this, when you have the spermatic cord which comes out, it is only that you have the internal spermatic fascia which will be seen that envelops the spermatic cord, and then after that you have the epididymis and you have the testes along with it. Now, what is important for you to remember and know is that along with this picture, when you have the epididymis, there is another layer which becomes very important during an hydrocele surgery is a tunica vaginalis, which technically is known to cover the testes as two layers. As you can see in this picture, this layer is just called as the parietal layer of the tunica, whereas this layer is called as the visceral layer of the tunica. Now, in between them, you have the testes, and over the testes of the epididymis, from which the origin of the spermatic cord will usually start, and so this one is the spermatic cord. We will not be talking about the contents of spermatic cord, so that means if you understand how does these things takes place or what is the origin of a testes and what is the origin of a scrotal swellings. Now, majority of scrotal swellings will either arise from the testes or they will arise from epididymis, rarely from the spermatic cord, or they can arise from the skin. Now, this can be one approach, but is not very useful in the classification because for a clinician, you need to think about in a diagnostic manner what can this be. Like skin swellings that are common in an examination will include a sebaceous cyst of the scrotum. Is a common case during an MBBS examination. Now, next one is in the specimen class, I will be showing you pictures of a sebaceous cyst of the scrotum. Now, the next one is testicular swellings can again be various things. It can be either a neoplastic swelling, like a testicular tumor. It can be an infection like an orchitis. It can be rarely a degenerative swelling like a torsion of the testes. Now, epididymal swellings are usually cysts, whereas spermatic cord swellings are very rare and can include something called as an encysted hydrocele of the cord, and there can be tumors in the spermatic cord as well, but they are extremely rare. So this is one way of classifying a testicular or a scrotal swelling. But for a clinician, this is not exactly the story. So we have discussed about the anatomy of the scrotum. That is something that we require. We have discussed with now the contents, that means the testes and epididymis, the spermatic cord. We have discussed about the various layers. We have discussed about the visceral layer and the parietal layer of the tunica vaginalis. And then we have also discussed about something called as the skin of this. Now we'll erase this picture and then let us go to what a clinician does to understand what is the origin of a spermatic cord or a scrotal swelling. Now for this I got this algorithm from one of the books, and I really find this algorithm as a clinician to be a very, very important thing to understand. Now, sorry. Now, whenever you get a scrotal swelling, the first things first, whenever you get a scrotal swelling, what becomes important in a scrotal swelling is to make the mark that what is the difference or what is the now in a scrotal swelling your approach then changes. The first question that you ask yourself is, am I able to get above the swelling? So the first question in concern is, am I able to get above the swelling? Now, this technically means that if you put your fingers, if this is the scrotum, and then if you put your fingers and index, the four fingers behind, and the thumb in the front with the gloved fingers, you should hold that, and then palpate the spermatic cord. Now, what is normal? Normal is that you should be able to feel the spermatic cord as a normal content. That means a normal person will have the same thickness of the spermatic cord. Now, please understand the picture. Now, if it is an inguinoscrotal swelling, that means on this side, say for example, the swelling will somewhat be like this, and so this is called as an inguinoscrotal swelling. Whereas on this side, so that means for an inguinoscrotal swelling, you cannot get above the swelling. Whereas in a case of a scrotal swelling, you can get above the swelling. Now, believe me, this is the first and the most basic step that every examiner in a practical examination will always like you to have. So, the first part is getting above the swelling. The swelling, that means again, I will repeat, this will thus be called as then a scrotal swelling. Whereas if you could not get above the swelling, then this will be called as an inguinoscrotal swelling. Now, if you talk about an inguinoscrotal swelling, let us talk about that. Now, inguinoscrotal swellings can again, there are many other causes of inguinoscrotal swelling, but the more commoner ones to start with includes, always remember, either it will be a hernia, that means usually an indirect inguinal hernia, which will mean that this hernia will have a cuff impulse that is seen positive. That means what type of cuff impulse is it called as? Expansile cuff impulse. Number two, any hernia is reducible. Number three, the testes may or may not, now please mark my words, may or may not be palpable. And the last one is, if you follow out a transillumination test, then transillumination test is usually not well appreciated. Now, don't say that it is negative. In a child with a hernia, it is not absolutely negative. But what you are required to remember is that a hernia is going to have these findings. So always remember that. So what are the points that I've told you? Hernias are known to have an expansile cuff impulse, reducible may or may not be palpable, sorry. Testes may or may not be palpable, and as I've said, transillumination is not at all very well appreciated. Now, on the other hand, now if you omit this thing out, so if you've talked about a hernia, what is the other end of this one? The other end of such a swelling will thus be called as an hydrocele. Now, what do we mean by this one? This means that we'll be talking about a hydrocele in a different class. When you talk about a congenital hydrocele, that technically means, believe me, is a hernia again, but the mouth is so narrow that only water or the peritoneal fluid comes in and it becomes transilluminate. So, that means, should you get a cuff impulse? The answer for this is yes, I can, and sometimes I don't. So don't only blindly say that I cannot get a cough impulse. Depends upon the size of the orifice that determines whether you should get a cough impulse. You may or may not get. But what is always important is that it is not reducible. And again, an hitch in the story. Congenital hydrocele, that means something which communicates with the peritoneal cavity, are used to be set as a delayed reducible. That means at the daytime, when the baby is standing, gravity pulls out the fluid into this. Now, when you try to reduce this, there occurs an event called as leakage. That means it is basically like if you have a bottle of ink and then you try to empty that bottle of ink, it does not get emptied immediately. So what happens is then this ink in the bottle will take time to empty. So that is the reason, as the mouth is very narrow, this hydrocele is not easily reducible. But when it occurs in the night, when the child is supine, it is partly reducible. So if you ask you a single blanket one, is it reducible or irreducible? The answer may be no, it is not reducible. But still, take it with a pinch of salt. Things are not so easy or not so straightforward. In the night, it does decrease in size. But remember, I will use the word delayed reducible. What does make the point very important is this sac is brilliantly transilluminant. So I will mark it with a color now. And this sac, as I've said, is brilliantly transilluminant. So this sac is brilliantly transilluminant. Now, what is important is if it is brilliantly transilluminant, the next point of concern for you is that what is the next one? Is the testes palpable or not? The answer for this is the testes may or may not be palpable, but is usually not palpable. So I will again repeat, should you have a cough impulse? The answer for this, if I am talking about a cough impulse, is yes and a no. I think that yes. So if I am asking, should you have a cough impulse? The answer for this is usually no, but yes, maybe that we are talking about this. Number two, is it reducible? Usually not. I will again repeat facts. I have told you something called as an ink bottle phenomenon. Number three is it is brilliantly transilluminant. So please remember, it is brilliantly transilluminant. Remember that hernia is not, it does not contain any bowel, it is brilliantly transilluminant. Number fourth is testes is usually not filled separate, but if this thing stops above the testes, not exactly called as a congenital hydrocele, but still testes may be palpable. So make these things points very clear. Now I have taken a picture as I've said. So if I make this part of the picture for you very prominent, these swellings are called as inguinoscrotal swellings, hernias and hydroceles. It can be a congenital hydrocele, it can be an infantile variety of hydrocele. In the hydrocele class, we'll talk about them. But what is important for you to remember in an examination, both theory and a practical, is these swellings are inguinoscrotal swellings. So I'll again repeat for the final time. They can be either a hernia or an infantile or a congenital variety of hydrocele. So with this, we complete the first question. Can you get above the swelling? So now let us go to the second question of all. So as I've said, the first thing rules out an inguinoscrotal thing that is coming down into the scrotum. Now let us talk about swellings exactly located in the scrotum. And the next question that we have for you is the testes palpable separately from the rest of the swelling? Is the testes palpable separately from the swelling? Now, if you remember the rule is very simple. Now, if you remember the rule becomes very simple, in which understand that the testes, now, if you could not palpate the testes, remember that. So what we will do is that, just give me a sec. Yeah. Now, so the next of the points to discuss includes that are you able to palpate the testes separately or not? Now, if you talk about that, this one, remember the logic is very simple. If it is the rule number 2, if it is a scrotal swelling, then whatever you are required to remember is the testes separate, or the epididymis is separate, or is the testes not separate? Now, this will mean a lot of difference, guys. If the testes is not separate, that means that this swelling is probably arising from this swelling, remember that, is probably arising from the coverings of the testes, and or it is arising from the testes as such. So go by logic. The logic says that if you could not palpate the testes, either it is a covering thing that is arising or in testes. Now what do I mean by this covering thing in this? Again, simple words, understand that. As I've said, think about the coverings of the testes. What do you mean by this? This is the testes. I will take my pen, or that, sorry, my pencil, and then what is the thing that I'm trying to draw, guys? I'm trying to draw the tunica vaginalis, and then I am trying to mark the visceral layer, and I'm trying to mark the parietal layer. Now, in between them, if I have an fluid collection, so that will not make the testes palpable, as you can see in this picture. So the testes is not palpable now. So this type of swellings, as you can see, that surrounds the testes and thus are technically fluids, will thus be called as an hydrocele. So this type of swellings which surround the testes are called as hydrocele. What is this particular point about an hydrocele? Again, scrotal swellings. So again, so what are they? They are scrotal swellings. Point number 2 to remember is that that these swellings, apart from being a scrotal swellings, will the testes is not palpable separately. Number 3, they will show a fluctuation. Okay, in the video in the hydrocele class, I will show you what is fluctuation. And number 4th, you will get to see a positive transillumination. Again, in the hydrocele class, we'll talk what are the conditions that you do not get a transillumination. So always remember these points. So what are the important things? Scrotal swelling, testes not separately palpable, fluctuant, usually will have a positive transillumination. So what are they called as? They are called as hydroceles. And what variant of hydroceles? They are called as vaginal hydroceles. Please remember that. So that is something called as a scrotal swelling, and you are required to know what exactly is a scrotal swelling with hydrocele. Examiners will be asking you this one from the covering. Now, when you talk about the testes proper, now testes, when you talk about them proper, well, now I will erase this picture. I will erase everything in this area, and then we will again divide this. As I've said, this is a part of a long question, sometimes of 7 marks. Now, if you talk about swellings that arise from the testes, then the root of this is very easy. When you talk about the testes, remember that we talk about this to be a tender swelling, okay, and a non-tender swelling. Now, when you talk about a tender swelling, remember that tender swelling can be very classically seen in 2 conditions, technically 3. One is a torsion testis, which you always should keep in mind as number 1. Number 2 is an epididymoorchitis, which means an inflammation of epididymis on the testes. And number 3 is called as an acute hematocele. That means the collection of blood around the testes. Okay, so these are all called as tender swellings. That means number 1 torsion, number 2 epididymoorchitis, number 3 is acute hematocele or collection of blood around. Again, I will repeat, number 1 is always a torsion of the testes. Now, when you talk about the next one, non-tender swellings, remember, are usually not common, and non-tender swellings will again have 3 counterparts. Most common one is a chronic epididymoorchitis. Next one, rare in India now, syphilis or the gamma of the testes or the tuberculosis of the testes. And what people diagnose more commonly is very rare, is technically a testicular tumor. What must always be kept in mind, if you have a hard painless swelling in the testes. So please mind these points again. If it is a painless swelling, mind it that it can be a testicular tumor, rare but should be kept in mind. Most common one orchitis, rare in India now is gamma of the testes and TB. So please remember what is important for you to distinguish is, guys, very simple ones. Just to remember is pain. If it is painful, always remember, if it is painful, it is a torsion of the testes, epididymoarthritis. If it is painless, then remember, if it is painless, then it can be either an epididymoarthritis, a gamma, and a testicular tumor. Please remember, this is the most common one, and this is the most dangerous one. So this completes, if the testes are not separate, what are you going to do? Now let us proceed a bit further, and then let us proceed a bit further, and then let us ask about the next group of questions. What if the testes is separate in this case? Now, what if the testes becomes a bit separate? Now, this one is not a big list, and whatever you are required to remember is that you can then talk about that if the testes is separate, then what are the findings that we can have from this one? Findings from this one. Now, if the testes is felt separate, please remember that you can again now do the third test called as a transillumination test. Now, if you can do the transillumination test, which means you're shining a torch in a dark room, remember two words. The word is a torch, and the next word is a dark room. Please remember this. In examination time, you usually do the first one, forget the next one. Now, transillumination test, remember, is now going to distinguish if it is separate from the testes. Now understand this one. If I'm talking about a transillumination test, you can have swellings then which are divided into two categories. One, if this is the epididymis and this is the testes, I will enlarge the picture for you guys. This is a spermatic cord. Appreciate that I have a swelling away from the testes, and this swelling, as you have seen, is separate from the testes but is transilluminant. Now, this kind of swellings can again be of two types. Appreciate this one. Either it is much away from the epididymis, or you could not separate the epididymis from this one, but both of them, remember, appears to be transilluminant. Please see these pictures, two ones. This one, sorry, yeah. Now, the first picture that I have shown is something called as an encysted hydrocele of the cord and is a remnant of processus vaginalis. We'll talk about that in hydrocele class. Whereas the next one is something called as an epididymal cyst, which was called as spermatocele. There are still confusions. Urology guys will call them, both of them are the same. They're the same things. Forget my spelling. They are called as a spermatocele and an epididymal cyst. So you have an epididymal cyst, you have a spermatocele, which are more or less same. Well, there is a fine line of difference between them. But what you are required to know as an examinee is that in an epididymal cyst, you cannot distinguish between the epididymis and the cyst. Whereas in a case of encysted hydrocele of the cord, you can differentiate between the epididymis below, testes below this epididymis, and then you can also have the brilliantly seen encysted hydrocele, which is then. But just one important quick point to note about in this one is, remember that this swelling gives something called as a traction test. That means, apart from being fluctuant, apart from being transilluminant, there is something called as a traction test. That means if you pull the testes down, this swelling will also move down. So these are the things. Remember that both these cysts are fluctuant. Both these cysts will show transillumination, but on this one you get something called as, what is this test called as? It is called as a traction test. Sorry, it is called as a traction test on the testes. So this completes the first part in which we talk about that it is transilluminant. Now let us talk about the other end of the story. What if this thing is not transilluminant? So we have talked about things which are transilluminant. What if this thing is not transilluminant? Then what happens? Then those things are again uncommon things. And if transillumination, remember, is negative transillumination, then what do we have? Then if it is a negative transillumination test, then remember our list definitely goes small. That means you have a very small category, and remember that you have usually three types of swelling. One of them is called as an acute epididymitis. What does it mean? It technically means that if this is this one, this is the spermatic cord and this is the testes. What is important is that if the epididymis gets inflamed only, now not a common one, but with an urinary tract infection with a retrograde flow, what is important is that you get an epididymitis, which means that there is a tenderness usually located in the upper pole of the testes. Number two, so that means if you see the scrotum, particularly on the posterior aspect of the testes, you get this one. Number two, there is a tenderness on this one, but this tenderness is usually between mild to moderate. Now, the etiology varies starting from a chlamydia to a gram-negative organisms, but epididymitis is sometimes as a part of an urinary tract infection with a retrograde flow or as a part of a sexually transmitted disease. So please remember this one. So this is the single word to remember is, if the transillumination test is negative, if it is tender, I will take a red ink to make you remember this one. If it is tender, think about this thing. Now, on the other hand, if it is non-tender, then guys, you have two problems with you. If there is a history of tenderness, if there is a history of pain and an UTI, and now you feel that the spermatic cord, the epididymitis, is usually having a beaded like appearance. Appreciate the picture. So it has a beaded appearance. Sorry for the wrong spelling. It has a bead like appearance. And then this bead like appearance is marked by a minimal amount of tenderness that you see in the epididymitis, and this one usually extends up to the spermatic cord. Now, as I've said, it is mildly tender. It is not that it is not tender, it is mildly tender. So this one is a typical example of a tuberculous or a TB, T for T, epididymitis. Some people say that TB is difficult to diagnose. They give it a name of chronic epididymitis, not orchitis, please. Remember that technically we have distinguished orchitis in the last group. The last one and the most rare one. If you have a testicular tumor which is small in size and is exophytic, what do I mean by this? That this is the epididymitis, sorry, epididymis. This is the testes, and so let us now make a testicular tumor out of this, and then let us try to make a testicular tumor. Now, this testicular tumor is a rare one, as I've said, and you'll rarely get a testicular tumor which, remember, will be an exfoliated like this. So, as you can see, testes, tumor, and an epididymis. So, these are the three things for you to remember and understand for your exams. So, this more or less completes that one. What please remember is that appendix of the testes and appendix of the epididymis will usually present with a torsion, and they are technically indistinguishable from a torsion of the testes clinically until unless you have done an ultrasound, which proves that. So we have said about the whole approach to a scrotal swelling. For a very quick recap of the whole class, what I will do is that ever if you have a scrotal swelling, the first step to distinguish between a scrotal swelling and an inguinal scrotal swelling is getting above the swelling. So the step number 1 is to get above the swelling. You can see this graph and you can have this graph. So what is the first step done? So I will take up this graph now. Right. Now see this. So the step number 1 is, can you get above the swelling, is a step number 1. Number 2 is, if this distinguishes between an hernia and a hydrocele, then the next step that you are required to remember is, so the first one is, can you get above the swelling, is the step number 1. The step number 2 is, now if you can get above the swelling, that means the swelling is a scrotal swelling. The next thing is, can you palpate in the step number 2, sorry, can you palpate the testes being separate from the swelling? Well, if you could palpate the testes which is being separate from the swelling, then the step number 3 is it tender? And the step number 4 that is common to both is it trans-illuminant? So please remember this one. So I will again repeat. What is the first step that is done? The first step that is done is, can you get above the swelling? If you can get above the swelling, so I will again make the algorithm for you. So if the first step is, can you get above the swelling? The answer is, if the answer is a no, that means your swelling is an inguinal scrotal, which can be a hernia or a congenital hydrocele or an infantile variety of hydrocele. Now, if the answer is yes, what is the next question then? Can you palpate the testes separate from the swelling? Now, if it is testes that is separate from the swelling, then please remember, you now have two options. If it is yes, then that means, now go for, if it is yes, then that means the next test that you do is transillumination plus followed by tenderness. As I've said, if it is transilluminant, as I've said, if it is, there can be two sides. If it is transilluminant, then it can be an epididymal cyst or it can be an encysted hydrocele. If it is non-transilluminant, then it can be one of the three. What can this be? If it is acutely tender, I told you this one, then it can be an acute epididymitis. Okay. Now, if it is not that acute, but it can be chronic or tubercular epididymitis, extends into spermatocord, bead-like appearance. The last one is a very small testicular tumor, which is exfoliated from the testes. So it is just a pedunculated tumor-like thing coming out from the testes. Now, if the testes is not felt separate, then your question is, what will you do? Again, the same group of tests. Go for a transillumination. Go for looking into tenderness. Now, guys, if it is transillumination positive, fluctuation positive, this is a vaginal hydrocele. Whereas if it is transillumination negative, fluctuation negative, and it feels firm in consistency, then it is either one of the three. What can this be? Very tender, red ink, as I've said, is an acute epididymoorchitis, mild tenderness, okay, orchitis, non-tender, it can be testicular tumor. But again, make the points very clean. As I've said, an acute epididymoorchitis, remember what is the next DD? Testicular torsion. Chronic epididymoorchitis is mildly tender, may not be tender, but remember that if it is non-tender, talk about an epididymoorchitis, gamma, and a TB. So this is your whole algorithm for the class, and this finishes your topic of testicular swellings and this. So we now return back with the next class on something called as an hydrocele, and the next class then is thus on hydrocele.